Hi, my name is Nicole Talcott, and this is my AVMA task video for Lab Animal Management through Cedar Valley College. I have Tiny here. She's our little rat. She is in a little travel cage. Her normal cage is larger. She has a shoebox type cage where it's solid at the bottom, where there's bedding that is going to be dust free, absorbent, and a normal cage that's larger is going to have lots of different levels and platforms and things that add enrichment to her life. And normally there's a water bottle that hangs from the cage, so there's always water. And then there's usually either a trough for food or a feeder style. And they eat rat chow that's commercially made, and you can also supplement with vegetables and fruit and seeds. And I've been feeding her and she thinks I have more food. So rats have restraint of rats. You can either scruff them by the hair on the back of their shoulders, or you can hold them with 2 fingers above their arms and 2 fingers below their arms, and then you can work with them that way, giving them injections or performing procedures. And then, okay, so rats, they're easy to identify their sex. The females, their nipples are easily noticeable, and there is a smaller area between their urogenital area. The males have a larger area that allows for their scrotum, and so you can see she's a female. You can see her nipples down here and the smaller distance in her urogenital area. Breeding tends to occur at night. Gestation period is about 22 days. Their sexual maturity for females is between 37 and 67 days, and the males is 40 to 75. They usually have anywhere from 6 to 12 pups. So I'll be giving Tiny a sub-Q injection over the shoulder blades. So I'm just gonna scruff her here. Oh, I know. You're spinning. Yes. And kind of go in at a 90-degree angle and inject, and that's it. Okay. All right, so we're gonna draw blood from a rat. So we've put a little bit of alcohol on the tail, and it's the lateral tail vein. So you just put a little alcohol on there, and you let the alcohol air dry, and you kind of hold off above, and then probably halfway to a third of the way down, you just enter in the blood vessel, draw back, and you can see I'm getting blood into the hub. Okay, and then you remove and you put it in your container. Hi, I have a mouse here. I also have a rat here, but I just want to talk about mouse handling and care and go over some of the restraint and reproduction and dispensing medication. Now this is a travel case, so it's obviously smaller than their normal environment, but we want to note that we have bedding in here that's soft, dust-free, absorbent, and their typical type of housing for a mouse that we're kind of dangling there would be to have a solid bottom with a wire cage top that's referred to as a shoebox style cage, and then rats and mice eat pellets or seeds, so you want to have that available to them. As far as their water goes, you want to have a hanging water bottle system that works best. Avoid having the ball be plastic so they don't chew on it. But overall, the care for a mouse is pretty similar to that of a rat. And their identification purposes can be tattoos on their tail or their ear or their foot. They can have punches in their ear. At a vet clinic, they can have cage cards. You can clip a little bit of hair, really note their color markings if they're colored. So some of those are a little more temporary as opposed to a tattoo or a microchip for them. Their sex and reproduction, males and females take about 35 days to reach puberty, and they're fully sexually mature from 50 days for males to 50 to 60 days for females. The females are spontaneous ovulators, and their gestation period is 19 to 21 days with an average of 10 to 12 pups per litter. And the breeding normally occurs at night. And it's usually about 12 to 24 hours after they've had their pups that they can start ovulating again. So now we will go into restraint. Restraint, and you can see I've got it scruffed and I'm holding the base of its tail. Next we are going to do an IP injection. So we kind of hold the body on the back, and then head kind of a 30-degree angle down, and the lower left quadrant we just angle in and we pull back, and we don't have any fluid, so then we just inject the fluid right into the intraperitoneal space. And then for the sub-Q injection, I feel like this might not go as smoothly. We can kind of go right at a 90-degree angle towards the skin, and the same thing, pull back and inject forward solution. And you want to use a small gauge needle, and so we're going to give it a little oral medication right in the mouth. We have Tinkerbell here, and we just have an example of a cage for Tinkerbell. We have a litter box. She's litter box trained, and you just want to provide them with a soft bedding that is either like a shredded newspaper or grass. You'd want to clean that out with a acidic cleaner, since their urine is very basic, and to dissolve the crystalline material that's in with their urine. And as far as their diet, consists of very high fiber foods, so lots of grasses and good quality hays. Timothy hay is an example of that. And then you can supplement with papaya juice also to help reduce hairballs. Some people mix that in unpasteurized papaya juice or pineapple juice mixed in with a little Timothy hay to get them to eat it, and that'll help dissolve hairballs as well. Again, they want to have at least 25% of their diet be a high fiber diet. Some people, as long as Tinkerbell's majority of food is a pellet variety, and you just want to read the label and make sure that it's higher in fiber. There are different labels that have different variations of fiber content. There are hoppers that hang from the cages that you can have the food in, as well as water bottles that hang from the cages. Tinkerbell drinks from a bowl and eats her food from a bowl, so we'll just give her water. And as far as environmental enrichment, we want to give her things to chew on, like kongs or nylabone type material. Wood blocks would be another thing, something to help wear down her teeth, give her something to do. They also at night are coprophagic, and they eat their stool. It's a special stool that has a mucus layer around it. It helps aid in the fermentation of the high fiber that they eat all the time. We also want to note there's a couple of ways to identify the rabbits. They can have tattoos in their ears. They can have cage cards. You just want to also note the breed of rabbit, their coloring. That can help you determine if you're working with the correct pet at the moment. So I have Tinkerbell here, and she is a rabbit, and rabbits have long ears. The domesticated rabbit has a little bit shorter ears than the wild rabbit. They have long legs, and the pads of their feet they're absent. They just have hair in the place of their pads, and they are in the suborder Rodentia, which they've since been separated from the rodent itself because they have wolf teeth, which are smaller upper incisors that sit behind their visible incisors, paired incisors. They also have a very short tail, and she's a little nervous, so we kind of have her all bundled up here, but they have very strong muscles in their back legs, and one of the ways that we can restrain them is by scruffing them, and she's not really enjoying that, but we can tuck their head kind of behind our little armpit, and then you support their back legs so they don't really have a whole lot of room to move, because if they try to jump, they can actually jump so hard that they can break their back, and then that's a irreversible situation for the little rabbit. So, with rabbits, to determine their sex, we just apply a little bit of digital pressure, and the females have a slit-like opening, and the males have more of a round opening, and a penile sheath will show up. Rabbits are, females are induced ovulators, so that means that kind of the mating occurs first before they ovulate, and female rabbits have 2 cervixes, they have no uterus, they have generally 4 to 12 kits, and males and females have a range of 22 to 52 weeks of age when they reach sexual maturity, and gestation is 30 to 33 days. Rabbits can have injections in several different varieties. They can have IM, intramuscular injections into the quadricep muscle or the epaxial muscle in the back. They can have sub-Q injections. Most anywhere, the easiest location for subcutaneous injections would be the scruff or back over the back of the neck area. They can have IV injections in their cephalic vein, in their marginal ear vein. They can also have IV catheters there. We are going to administer a little bit of lactated ringer solution in a sub-Q injection right over the shoulder blades. So we're just going to kind of move the towel back a little bit, pull up the skin, pull back a little, and advance the solution. Just like that, and she was nice and calm. Next, we're going to be drawing blood from her marginal ear vein, and we've applied a little lidocaine solution to her ear just to numb the skin so that it's not quite as sensitive when the needle pokes her skin. We're just going to apply a very small amount of alcohol. We have a 25 gauge needle, and we just kind of just slowly, patiently wait for the blood to flow. And we have a few little drops. I will be restraining a bird today, and it's a good tip to have the lights off, your voice is low, approaching the bird slowly, so I will be doing that right now. So a good tip is you just kind of want to hold their head kind of between your forefinger and their thumb. Okay, so we have another little bird here. It's a tiny bird, so we don't need to use a towel for restraint, but we have a little nail trimmers and a little quick stop if necessary. And some birds have white nails, and so then you can see the quick really well. And so we are just gonna trim, make sure we don't trim into the quick. And there we are. That's all we need for that little guy. And their thumb, and you can examine their eyes. These eyes are nice and bright and clear, no discharge. The healthy birds, you don't need to trim their beaks. You can assess their feathers. Some birds have powder on their feathers, not all of them do, as well as some birds have powder on their beaks. You can slowly, at the angle that the wing moves, you can pull and extend and view the wing. You can also, this bird is kind of flipping around, but if we were the right side up, you could assess the body condition score by the size of the pectoral muscles, and you can also examine their crop with a transilluminator to see how much mucus is there, as well as examining their cloaca with a moist cotton tip applicator and extruding part of that and viewing whether there's any growths, as well as their feet and toes you can examine. The bottom sides, they can have little sores, pressure sores. So we'll let this guy go back in here so that he can relax.